This segment is sponsored by Trinity Health. This is not a stereotype. Men often ignore their medical symptoms, and that's not good. So, guys, if you have been hoping that problem with urinating will just fix itself, well, it probably won't. It's time to talk to your doctor about it. Dr. Navneet Mander is a urologist with Trinity Health, and he is here to talk about aquablation therapy and how it might help. Hi, Dr. Mander.
Hi, how are you? Thanks for having me.
I am happy to. Tell me about aquablation therapy. What is that?
So, aquablation therapy is a new surgical technique that we use for enlarged prostate. These are targeted, we're targeting men who have problems with urination, the typical frequency, weak stream, urgency, waking up at night to urinate. Those men who maybe they're a little afraid to go to the urinal because it takes a little longer to completely empty their bladder out. They have to strain. So, aquablation therapy uses the power of water delivered with robotic precision to open up that channel, make it easier to urinate with long-lasting relief of your symptoms, kind of in a predictable way, without compromise, no matter what size your prostate.
So how does it work?
So aquablation therapy, typically enlarged prostate causes a kinking of the hose, obstructs the outflow. All of our surgical treatment options are aimed at opening up that channel so that you can urinate. Aquablation therapy is unique in that we use ultrasound imaging with a live camera view of the entire prostate. This allows us to map the entire prostate and essentially pick the portions that we want to remove and those that we want to preserve. Once we've created a surgical map, the aquablation uses a heat-free water jet with robotically controlled heat-free water jet that will then remove that tissue that we previously mapped. The robotic technology minimizes human error, so we're only removing those portions of the prostate that we want to remove. This allows for a wide open channel with minimal side effects.
Let's talk about side effects, though. You say minimal, so what kinds of things do you see?
Sure. So we know that the primary cause for men to avoid surgery is because they're worried about the side effects. A recent survey showed that 85% of men were afraid that the surgery would lead to leakage of urine. 80% of men were worried that the surgery would lead to an irreversible change in their sexual health. If you really look at the robust clinical trials that we have, the research that we have, the opposite is true. Men who underwent aquablation therapy had very low rates of irreversible complications. If you really look at the specifics, 0% of patients who underwent aquablation therapy had erectile dysfunction, change in sexual desire, and change in overall sexual satisfaction. Very low rates of men had ejaculatory dysfunction, and more than 99% of men did not have leakage after the surgery. So this is all possible because of that heat-free water jet that minimizes collateral damage to the other tissue, and the robotic component that allows us to deliver precise removal of that tissue.
So what does recovery look like?
So as with most of our BPH or enlarged prostate surgeries, patients will wake up from the surgery with the catheter in place. Typically, there's an overnight stay in the hospital and they'll be discharged with the Foley catheter in place. On average, that catheter gets removed after about 1 to 3 days. Usually mild irritative symptoms, things like frequency and urgency for the first couple of weeks. And then typically by about a month out, patients are doing quite well. Patients are on their feet within a few days, and usually we'll see improvement up to about 6 months out from the surgery.
Certainly good news. I know it requires a referral from your physician. So folks who are wondering if they're a candidate should speak to their physician first. And for more information, they can visit trinityhealth.org/aquablation. And we will put a link to that on our website, 13onyourside.com. Dr. Mander, thank you.
Well, thanks for having me.